No one warned me about these 5 things that made recovery either manageable or miserable. Today, I'm going to tell you the 5 things I wish I would have known going into ostomy surgery. Today, I'm going to tell you the top 5 things that I wish I would have known going into ostomy surgery. Now, this isn't medical advice, it is my subjective opinion. And I do think that some of these things on this list I haven't heard mentioned before, so I hope it's helpful to you. One, you're not doing a lot when you're in the hospital, but there are things that you can bring to make yourself more comfortable. The extent of your reach when you're in the hospital is going to be your bedside table, so bring things that actually matter. I would recommend an extra large phone charger. I would bring headphones or earplugs if you're a light sleeper. I would bring a robe for extra layers to take on and off. With the IV line, you're not going to be able to bring an arm in and out of a jacket or a hoodie or things like that. So the robe is kind of nice. You can kind of like wrap it around you. And then I would also bring safe but comfortable slippers because the hospital is dirty and you don't want to be caught walking around in just those socks that then you're going to put in your hospital bed. I have made a full packing list that I did modify post surgery on what I brought to the hospital and what mattered and what didn't matter. So if you guys are interested in that, if you want to drop a comment below and let me know, I can either create a guide or make another video on what I packed for the hospital and what worked. Number 2 on this list is one that actually shocked me and no one prepared me for before surgery, which is that if you have laparoscopic abdominal surgery or keyhole surgery, the surgeons will pump gas into your abdomen in order to inflate and kind of create more space so they can see and navigate around in your abdomen a little bit more easier. Now, what that does is in the days following surgery, those gases still kind of linger and it irritates your phrenic nerve. And your phrenic nerve runs from your neck to your diaphragm. And the brain is kind of funky when it comes to nerve pain and it gets a little confused. So it will manifest in what feels like extreme shoulder pain, like you've been clenching your shoulders up to your ears for like multiple days on end. There's unfortunately not a lot you can do about it, just knowing that it is temporary and it's normal to expect. And number 3, before you go into surgery, you need to identify someone who is going to advocate for you. Now, this isn't just someone who's going to visit, it is someone who is going to be there for the majority of the time that you're in the hospital and is going to be present in case anything arises. That person is going to ask questions, they're going to provide pushback when necessary, and they're going to take notes. I remember my sister being the dedicated person who helped me here, and she took notes frequently in case I forgot what they said or if I wasn't conscious when they came in the room, so she could kind of tell me what the plan was. This proved to be really helpful because my 1 week stay turned into 2 months. And when you're mentally tapped out, when you're medicated, when you're exhausted, it is hard to put the mental energy into trying to advocate for yourself. It may seem silly in the prep before surgery, but have that conversation with someone that ideally you know is going to be there the majority of the time and that you are very comfortable with, because it could be a sensitive matter. It could be you're just exhausted and you're like, I know I'm not great to deal with right now. But you know that person is in your corner no matter what. Number 4, before discharge, make sure you know exactly how to order your supplies and change your bag. I think I learned how to change my bag like 3 or 4 separate times because I was on so many pain medications that I don't even remember the first time I was taught how to change my bag. I was there, but I wasn't there for it. So make sure before you discharge, you go through a bag change feeling very confident, like you know what needs to come next. Make sure you know what troubleshooting things you need to go to. Make sure you have contacts like a wound and ostomy nurse that is in your area that you can go see should you have some problems post discharge. The ostomy supplies are pretty easy. You will be set up with like a third party vendor that will connect you with either probably Coloplast, Convatec, or Hollister. And that's how you're going to order your supplies. And you will learn what 1 month supply is worth, etc., like that. A little bit of a side note is that the setup that you're given in the hospital has nothing to do with what is best fit for you, but more so the hospital's contracts with different suppliers. So whether you get a Coloplast, Convatec, or Hollister setup, you can call or go online to their websites and ask for free samples if you're ever interested in trying out a different product, or if the products that are working not working for you, you want to troubleshoot and try a different brand. These should all be covered by your insurance, so you shouldn't be aligned specifically with a certain company. You should be able to try all of these, and I know for sure that the samples that you ask for are free. So if you guys want me to actually set up a call or a session online where I go through how you can order free samples from the different providers. That's super easy to do, and I'd be happy to show you guys. However, I will say when you're a beginner and you're new at this, ostomates tend to kind of just stick with what works for them. So if you feel like the setup that you're given post hospital is a great setup for you, then you're probably not going to want to sample things and try things just because it can lead to more complications in your life. Now that I'm 5 years out, I'm actually pretty interested in trying different brands. So I have been asking for samples from Coloplast, Compotech, Hollister, to just try different products to see. I work from home. I'm comfortable with trying out a different bag, and if it doesn't work, I can just rip it off and put my usual back on. But this is part of their free samples that you can ask for. You can go online or give them a call and speak with a representative who will recommend products for you to try, and they'll give you all of the samples that you want to try. Okay, I think I saved the best for last because 5 is one that I'm really passionate about. I have a background in physical therapy. That was the career I was in before I did a career change post surgery and moved into tech. I planned on reversing my surgery and using a J pouch. I have a J pouch now. I'm not going to reverse and use my J pouch, which is a whole other video to talk about if you guys are interested in. But I did want to reverse back. And for me, having my pelvic floor and having a strong, deep core foundation was really important to me. And so I asked my surgeon for a prescription to see a pelvic floor physical therapist post surgery, after I've had time to heal and I've been cleared to exercise. And that was really awesome for me. I'm really glad I went in. My core was very weak. I mean, I've had multiple surgeries throughout my life and I've never done deep core pelvic floor physical therapy. So I didn't really understand how deactivated my muscles were. Because surgery, in the nature of how it works, cuts through muscles, cuts through nerves, cuts through muscle activation that has to kind of grow back. And it is something that you need to strengthen as time goes on, or they will grow back and they'll connect, but they're not going to be as strong without putting in the actual work. It's kind of like lifting weights at the gym. Like you do need to physically work on strengthening them. A quick comment on why this is important. Even if you're not reversing, strengthening your core has studies that show that it will greatly reduce your chances of chronic back pain. The way to treat chronic back pain in the clinic, when I used to work in a clinic, was core exercises, movement, and core exercises. Your back is working overtime, which is why it's hurting because your core is not participating in the group activity. So I would really recommend strengthening your core just to make sure that it improves your overall biomechanics. It improves your core strength to reduce any injury, back injury, or further injury. And it's going to just give you a better foundation moving forward. Like I said, depending on how many surgeries you have, you may be surprised by how weak your pelvic floor is, but there is always a chance for you to be able to improve it and strengthen it with dedicated work on that. I actually have had a lot of conversations being in a leadership position with my ostomy community in my city, talking to surgeons and nurses and GI doctors post-op about writing scripts for pelvic floor physical therapy. It's something that they have kind of told me, oh, I've never thought about doing that, or a patient has never asked for me for that, but that makes sense. I could see why it makes sense. So I include this one because I do think it is important for your overall health and to prevent further injury down the line. These are one of these kind of comorbidities, things that come up because of the situation that you already have. So knowing, the more knowledge, the more power to prevent any other comorbidities that could come up with this. Like I said, this is my perspective on what I wish I would have known going into ostomy surgery. Some of it feels a little bit more obvious than others, but I would love to hear your guys' advice in the comments of what you wish you would have known going into surgery, or if you think I missed something big, let me know. Maybe. Thank you so much for watching, guys. If you enjoyed this video, please hit like or subscribe. It would mean the world to me. It would tell me to keep going despite all my cringiness in these talking head videos while I stumble through this process of learning what it means to be a YouTuber. Take care.